Welcome to the State of Cannabis Policy in California. Better is possible. My name is Merlene Tucker, and I'm here with my colleague, Jeff Bornstein. Together, we'll be running this Dialogue for Health web forum. Thank you to our partners for today's event, the Conrad Hilton Foundation, Getting It Right from the Start, and the Tobacco-Related Disease Research Program. Now it's my pleasure to introduce the moderator of this event, Kiara Gonzalez Garcia. Kiara is the program administrator for Getting It Right from the Start, a project of the Public Health Institute. Welcome, Kiara.
Thank you, Marlene. Welcome, everyone, on behalf of the Getting It Right from the Start team. As mentioned, we are a project of the Public Health Institute. We work with states, cities, counties, and community partners to develop evidence-based policies and provide guidance on cannabis policies that can help reduce harms, protect against youth and problem cannabis use, and advance social equity. Our panelists joining us today, first off, are Dr. Lynn Silver, the director of the project. She is a pediatrician, researcher, and public health advocate, as well as a senior advisor at the Public Health Institute and clinical professor at the University of California, San Francisco. Her interest in local marijuana regulation arose from her experience as a public health official and belief that more public health oriented measures are needed now to protect against youth and problem use in the setting of a rapidly expanding new legal industry for a product with significant harms. She received her MD and MPH degrees and pediatric training from the Johns Hopkins University and was previously visiting scholar at the Karolinska Institute. Followed by Dr. Silver is our policy associate, Arash Jason Surush. Arash works at the Public Health Institute. He is a registered dietitian and received a Master of Science in Public Health from the Johns Hopkins Bloomberg School of Public Health. Before coming to PHI, Jason was a cannabis product safety analyst at the Maryland Medical Cannabis Commission, where he co-authored edible cannabis product regulations for the state. He also served as a co-chair of the Association of Food and Drug Officials Cannabis Committee. Originally from California, Jason is a formerly trained chef who spent nearly a decade in the cannabis industry, developing businesses that grew medical cannabis and produced edible cannabis products. Our third and final panelist today is Dr. Alyssa Payton, the research scientist and co-director of the project. Dr. Alyssa Payton's past research focused on youth-targeted marketing and promotions of alcohol and tobacco products, examining the intersection between the unique vulnerabilities of youth and the psychosocial and neurocognitive appeals and techniques used in marketing. She is now translating that work as a research scientist at the Public Health Institute into the regulation of sugar-sweetened beverages and legalized recreational marijuana. Thank you all for joining us today. Lynn, can you take it off?
Thank you. Thank you, Kiara. It's a pleasure to join you all this morning, and thank you for being here for our webinar. I'm going to speak today on some ideas on how and why we can do better on cannabis policy. And in particular, the launch of an updated version of our model ordinance for California local jurisdictions on retailing and marketing of cannabis products. So, first of all, I just wanted to speak briefly about our project, the Getting It Right from the Start project. We started right after Proposition 64 passed in California with the goal of developing testing models of cannabis policy that could better protect public health, our young people, and social equity, as well as providing technical assistance to communities, government, local government, and community partners on these issues. We've since worked with over 100 state and local jurisdictions in the US and Canada, produced model laws for California cities and counties, and done other work. So just before we get into the nitty gritty, let's just remember, why did people want to change what was happening 5 or 10 years ago? And then we can really reflect on, does our current policy fix those issues? First of all, we had systemic racism in drug policy enforcement, which led to mass incarceration with serious effects, particularly for communities of color. We saw trafficking related violence, both in the United States and in countries around the world that export to the United States. And prohibition simply didn't work to reduce population consumption levels. So we had a set of policies that were not working well for basically anybody. Remembering a little bit of the timeline of what's happened over the last few years. So in 2016, California passed Proposition 64, legalizing recreational use after many years of legalized medicinal use. In 2017 and 2018, we had a period when state regulations were being developed. Because of our concern of inadequate public health and youth protections in those regulations, as well as equity, we drafted our first model ordinances at the end of 2017, and our first tax model ordinances in 2018 in January, which was right when the doors opened on recreational sales in our state of California. In 2018, the state, dissatisfied with the pace of legalization by cities and counties, passed a regulation saying that delivery companies could deliver anywhere in the state, which was 2 years later, basically they backed down after a court case. In 2020, we published our first review of local laws and taxes to understand what was actually happening in California, and Lisa will speak to that in a little while. Um, in January of this year, we published our first scorecards inspired by the American Lung Association, looking at what was actually happening across the state. And Arash Sarush will speak to those. And this month, we are updating the ordinance that we developed 4 years ago based on input and new experiences. Um, so First of all, why should we worry? Some people think marijuana is wonderful stuff, and indeed it does have some proven health benefits for medical use, such as chemotherapy-induced nausea, effectiveness for rare forms of epilepsy, and for control of certain forms of chronic pain. But at the same time, there really is substantial evidence of harm with use in a number of very important areas. When used during pregnancy, it's associated with low birth weight, increases in schizophrenia and psychosis, some of our most serious mental illnesses, increased motor vehicle crashes, exacerbation of chronic respiratory disease, but also we saw the vaping epidemic as a result of proliferation of unsafe products. And we see real problems with addiction, known as cannabis use disorder, especially when people start using young and use the products very frequently. And these are serious problems. Sorry, there's also rapidly emerging evidence of a series of additional effects, cognitive, academic, and social effects on people who use at a young age in particular. We are seeing growths in cannabis use disorder, which is essentially addiction to cannabis, not as serious as addiction to opioids, but with serious impacts on people's lives nonetheless. We're seeing increases in accidental ingestion and overdose and ER visits, and emerging evidence of cardiovascular disease. So all of these are causes for caution. But of course, the worst cannabis health related effect is sending people to jail. So whatever we do, we have to stop making cannabis be a cause for people to be arrested, to spend their lives in jail, which has devastating effects on their health and well-being, on the health and well-being of their families and of their children, sometimes for generations. And this is an area where we've made some progress, but not enough. So with trends towards decriminalization and legalization, we've seen some decline in marijuana arrests, which actually then went up again in 2018 and in the most recent time period. But if you look at the axis of this graph, it only goes down to 600,000 from 800,000, or a 25% decline, which is nowhere near enough. So we're still seeing large numbers of arrests for marijuana nationally. And these arrests are blatantly racist. We see very high ratios of Black people to white people being arrested for marijuana possession across the country, both in areas that have legalized and ones which have not, although arrest rates are lower where legalization has moved forward. In the state of California, for example, Black people are still twice as likely as whites to be arrested for marijuana possession even though our rates overall of arrests are lower than most of the country. So we still have a persistent problem with profound racism in our marijuana related arrests. But in addition to ending racist cannabis related incarceration, which is critical, there are other areas of health and social inequity that will be worsened if cannabis use increases. And our policies need to balance addressing these imperatives. For example, cannabis can affect brain development, and the most vulnerable periods are pregnancy and adolescence. Nevertheless, cannabis use has been rising in pregnant California women, nearly doubling even before Prop 64, with 1 in 5 young pregnant mothers using. And perception of risk has been declining. Use during this period is associated with low birth weight. And low birth weight is one of the longest term existing disparities in health outcomes, particularly in the Black community, where rates of low birth weight are much higher and have been a persistent and difficult to solve health disparity. Similarly, daily use of cannabis is associated with much lower high school graduation rates and degree attainment, falling perhaps half when used daily in this study from New Zealand. And again, high school graduation is an area where we have already existing severe racial and ethnic disparities in our state, with lower graduation rates in the Black community, in the Latino community, in the Native American community. So we do not want to exacerbate this by having increased rates of youth use, especially heavy use of cannabis. And we see that frequent use of high potency cannabis, which is actually not that high, even higher than 10% THC, has been associated with greatly increased odds of psychotic disorder. Any cannabis use daily increases risk of psychotic disorders about threefold, and daily use of high potency products increases risk or is associated with a fivefold increase in risks, which should worry us a great deal. We are seeing now major increases in daily use by youth over the last few years to levels not seen since the 1980s. And this is probably associated with the products that are out there. Cannabis use disorder, when it happens, is something that truly interferes with people's lives, reduces their quality of life, and it interferes with their goals and personal safety in many cases. So trends that we're seeing in the cannabis industry that may be leading to these problems include manipulating potency, which increases the risk of addiction and psychosis, creating flavored and other products aimed at attracting youth, and shameless and misleading marketing. So to what extent are our cannabis policies addressing these challenges? And really what we see is that our California state regulatory framework continues to be a recipe for addiction. It allows rampant marketing. It placed no restrictions on potency or flavors. It allowed health and therapeutic claims and does not monitor them well. It places no limits on the number of licenses unless local government does so. Warnings about health risks are in 6-point font and virtually invisible. And it makes no requirements for social equity in licensing. This has allowed a proliferation of a cannabis kids menu of flavored products, things like pink animal crackers, grape flavored blunts with added concentrates, cannabis infused root beer, Pride rainbow sherbet, cannabis orange soda, grape flavored high potency vapes, billboards that tell young people of color that this is the way to feel better in life, and then this is the way to be happy, which litter our highways. And the potential consequences of this are increased use especially in young people, increases in low birth weight, independency, potential increases in cannabis-related psychosis and mental health issues, and long-term effects on youth cognitive and executive function and academic outcomes. So in 2017, we put out our first version of a model ordinance seeking to address these issues. We, and in many cases, learning from the history of tobacco control. We proposed a local cannabis retail license be used to provide a framework on which to otherwise regulate this industry. that communities limit the number of dispensaries, that if allowing for-profit business, they prioritize equity licenses, that they prohibit delivery, which makes it easier for young people to get their hands on cannabis, that they prohibit flavored products and other products designed to attract youth, that cannabis businesses be specialized businesses, not restaurants or pharmacies or combined with other things, but specialized stores, that strong limits be placed on the potency of products allowed for sales, that we have prominent warnings in stores, that we not allow the return of smoke-filled bars and lounges through on-site consumption, that marketing be limited to the maximum extent allowable by law, and that if we were taxing, that we capture this tax revenue for youth and for prevention and reinvestment in communities hit by the war on drugs, and that we tax high potency products more. All of these ideas, as Elisa will note, have been adopted somewhere in California, but the state only adopted 2 of them, so there's very little large-scale impact. Just half of California jurisdictions are even allowing any legal sales. And this means that local law is critical. It's our major avenue to protect youth and public health, to promote equity, and to continue to innovate in best practices. So when we do our 2021 model ordinance, let me go over briefly what changed. Particularly, we tried to learn from experience such as those of Quebec, proposals in Rhode Island, experience from alcohol monopolies that regulate sales of a harmful product, allowing its legal sale, but looking for ways to allow legal sale without promoting or increasing consumption. The experience of Quebec is very instrumental. So they created the Quebec Society of Cannabis in 2018 as a public monopoly with the express purpose of allowing legal access without increasing consumption. They limited concentrates to less than 30% THC, required 5 milligram servings of edibles, did not allow sweets, confectionaries, desserts, chocolates, or other products attractive to those under 21, did not allow flavors or added odors. In the US, why cannabis remains federally illegal, this would probably have to be done through a nonprofit monopoly or franchise, authorized or regulated by state or local government rather than a public monopoly, but similar ends can be achieved. The result of that experience in the first year, Quebec already had lower use rates, but they saw much less increase in self-reported consumption early in the post-legalization period. So that's very positive. Similarly, Uruguay has a user cooperative structure and also uses pharmacies and a 10% potency limit on flower. So this led us to add a key recommendation to our new ordinance that the first choice for jurisdictions that are newly legalizing, if they choose to do so, is to go with a public monopoly through a nonprofit structure or franchise, operating under strict rules established by the city and county and using equity in hiring. Alternatives to that could be a nonprofit only model. And if you allow for-profit businesses, we recommend allowing only equity applicants in the first year to really make the equity system effective, which it currently is not. Another alternative is to do delivery-only models with no storefronts, but those can also be done in the same order as the earlier options through a public monopoly or nonprofits as well. We strongly recommend that if this model is used, whether through taxes or through franchise fees, the revenue be captured to support healthy youth development, prevention, reduce inequities in health, and mitigate the negative social impacts of the war on drugs. We also updated our equity in hiring proposal to make it mandatory. We changed and modified a number of the product regulation provisions, for example, based on what we were seeing in the market, not allowing concentrates to be added to flower or pre-rolls, increasing their potency, requiring metered dosing in concentrates like vaping products to reduce the addictiveness and health effects, we provided an option for vaping bans for jurisdictions who wish to do so, requiring that edibles be in individually wrapped servings in geometric shapes, not looking like teddy bears. In the wake of the vaping epidemic, we recommend prohibiting vitamin E acetate, as well as any other non-cannabis ingredients that have not been deemed safe for use in inhalation products by the Food and Drug Administration. We updated our descriptions of attractiveness to youth. We strengthen our definition of what a characterizing flavor is, because so many cannabis products, some of them actually have added flavors. Some of them have names and brands and pictures that imply flavors, even if those flavors are not actually present. We also added a requirement for what we're calling cannabis dose diversity. So if a store does sell high potency products, which virtually all cannabis retailers in California do, they would also be required to make it possible for a customer to follow safer use recommendations and go low and go slow. So if you have 10 brands of flower that are 20% THC, you need to also offer 10 brands that are less than 10% THC, for example, with less than 15% THC. You don't have to have the same quantities because we don't want people having backed up stock, but at least have the same number of products that you can all offer, both for edible and for flower products. We provided a model for warning flyers that can be given to consumers on safer use and health warnings, and some jurisdictions have done this. Just summarizing on the equity issues before I wrap up. So critical to cannabis policy in jurisdictions is ending unjust criminal justice. As jurisdictions enforce, they need to find ways of enforcing the new legalized systems that don't recreate the cycle of incarceration for small scale offenders who remain outside of the legal system. Many people, the cost of creating a dispensary compatible with state legal requirements is quite high. And we don't want protecting these new, often white investors to become a new reason for putting people in jail. Most importantly, we need a strongly regulated system that does not survive by increasing profits through increasing consumption, which is what we are actually seeing in most states that have legalized. We need to take the drive to increase consumption of this new industry. And to do so, we need to avoid creating a new industry that will prey on our most vulnerable, just as the tobacco and alcohol industries have done. We need to reduce disparities in health and educational outcomes that are driven by substance abuse and by arrests, and truly help our youth thrive. And we need to make sure that revenues from the cannabis industry are reinvested in youth prevention, education, community reinvestment, or addiction treatment. Those are part of the components of really having an equitable policy system that we tried to build into our model ordinance. So in summary, thank you. I'm going to pass on to my colleague, Arash Sarouche. Our project does continue to be available to provide technical assistance. We have a listserv. We invite all of you to join. And we try to work with as many jurisdictions as possible and community partners as possible to turn these policies into reality in many places. Thank you.
Thanks, Lynn. Right. So as Lynn said, my name is R.S. Jason Sarouche. I'm a policy research associate at the Public Health Institute. And today I'll be talking to you about our team's local cannabis policy scorecards. By the end of this presentation, you'll know what these scorecards are, why we created them, why they matter, and how we determine the jurisdiction's scores. So what are these scorecards? Well, using the model of the American Lung Association State of Tobacco Control report cards, which were first released in 2002 to grade states on how effectively their policies control the negative public health impacts associated with tobacco products, we developed a scorecard to evaluate policies adopted by jurisdictions in California that allow storefront retail sales of cannabis. The scores represent how far local jurisdictions have gone beyond state mandated cannabis policies to promote public health and support social equity. So why evaluate local cannabis policy? Well, following the passage of Proposition 64 in 2016, which legalized cannabis for adult use in California, the state needed to develop a system to regulate new cannabis businesses as well as the existing medical cannabis industry. They established a regulatory framework that required local authorization before issuing a state cannabis business license. Local governments were given the authority to opt in or opt out of allowing cannabis businesses to operate in their jurisdiction. So it's evident that California's cannabis regulations have strengths, but there are also some inadequacies, especially when it comes to supporting social equity and promoting public health. Municipalities that decided to allow cannabis businesses to operate in their jurisdiction can use applicable state regulations as a default for their local rules, or they can adopt additional provisions to control things like the manner in which cannabis businesses operate or where their physical premises can be located. So why do these scorecards matter? Well, we created them to serve as a tool for local regulatory agencies as well as public health advocates and other community partners. The scorecards identify gaps in state cannabis policies, measure how effective local policies go beyond state law to protect their more vulnerable citizens, and support people who have been disproportionately affected by the criminalization of cannabis. The scorecards will also serve to track changes in local cannabis policies over time, identify best practices implemented in jurisdictions throughout California, and nudge cities and counties towards the most impactful policy changes they can make. We determine the scores by conducting an in-depth review of local cannabis ordinances, city council meeting results, and other documents that identify cannabis-specific policies passed by local governments. Our review included 539 cities and counties in California, and we used platforms like CannaRegs, MuniCode, city and county websites, and even directly contacted local regulatory officials when appropriate. We determined the most effective and impactful way to utilize local control to promote public health and support social equity was by adopting policies beyond state law specific to storefront cannabis retailers. So we awarded a total of 100 points, which was divided among 27 specific provisions in 6 main categories that we determined the most impactful policies local regulatory agencies could realistically adopt and implement. Our first main category is retailer requirements, which includes provisions like limits on the number of storefront retailers and requiring a minimum distance between them, buffer zones between cannabis retailers and sensitive use sites greater than the state mandated 600 feet from schools, which depending on where you are in the country is somewhere around 2 to 3 city blocks, and requiring health warnings to be posted or handed out to consumers. Our second is taxes and prices, which includes establishing a local retail tax and ensuring that the revenue is clearly dedicated to supporting youth, preventing substance abuse, or promoting social equity. Our third is product limits, which includes adopting measures beyond state law to ensure products in their packaging are not attractive to youth. Our fourth category is marketing, which includes limits on things like billboards, cannabis business signage, and advertisements in general. Our fifth is smoke-free air, which includes provisions prohibiting temporary cannabis events and on-site consumption. And our sixth category covers social equity and conflicts of interest. Initially, we identified 147 jurisdictions in California that passed policies to allow storefront retail sales of cannabis before January 1st, 2019. So we evaluated how those jurisdictions regulated cannabis going into the year 2019 and privately disseminated the resulting 2019 scorecards to them directly. More than 10% of those jurisdictions responded with feedback, which we used to refine our methodology and shape our 2020 scorecards. So we identified 157 jurisdictions in California that passed policies to allow storefront retail sales of cannabis prior to January 1st, 2020, and use that information to create our 2020 scorecards, which is essentially our second round. And those evaluated how the jurisdictions regulated cannabis going into the year 2020. We privately disseminated those in December of 2020. These 2 rounds of feedback were intended to give jurisdictions a chance to review their scores, which proved to be very useful for us and them. For example, 2 jurisdictions had local hiring requirements that earned them additional points because per the Cannabis Healthy Places Index, the jurisdictions were economically disadvantaged communities. And therefore, that counts as equity in hiring requirements. So after incorporating any feedback from jurisdictions into the 2020 scorecards, we made them publicly available on January 14th, 2021. The average 2020 score was 19 points. The city of San Luis Obispo was the highest score with 52 points, and the lowest score was 0 points. We saw that our local cannabis policy scores improved by an average of 2 points between 2019 and 2020, and expect them to continue to rise in the years to come. So thank you so much for your attention. Feel free to email me with any questions. And now for a quick poll to lead into my colleague's presentation. So which of the 6 scorecard categories do you think most jurisdictions in California adopted policies in? And the options are retailer requirements, like requiring distance from sensitive use sites beyond the state mandated 600 feet from schools, taxes and prices, product limitations such as banning flavored cannabis products intended for inhalation, marketing limitations like billboard or business signage restrictions, smoke-free air requirements, and equity and conflicts of interest, such as equity business applicant prioritization. And there's about 30 seconds to respond. The results are, looks like retailer requirements is what everyone chose. Okay, and the runner-ups are taxes and prices, and then smoke-free air requirements, product limitations, and equity and conflicts of interest were a tie. 7% of our attendees thought each of those were the ones, and then marketing limitations came up last. So now Dr. Lisa Patton will give you more details about what we actually saw. So thanks.
Thank you so much, Jason. So I'm Elisa Payton. I'm the research director for the team, and I'll be presenting our findings on how many cities and counties across California have legalized storefront cannabis retail sales, how those jurisdictions scored on our card, and then who is doing the most to protect public health and youth. So, as Jason mentioned, as of January of 2020, there were 157 jurisdictions that had legalized retail sales by storefronts of cannabis. So that's almost 30% of all the 539 cities and counties in California, and it is a 7% increase from what we saw as of January of 2019. Now, a number of additional jurisdictions went with a delivery-only model. So either allowing non-storefront retail operations within the jurisdiction or allowing delivery from retailers located outside the jurisdiction to come in and deliver to residents within the jurisdiction. So we know that over half of California residents have legal access to cannabis, but it's these places we're focusing on that have the on-the-ground sort of footprint of the open retail stores. So of those 157 jurisdictions with storefront retail, 70% of them limited the number of licenses that would be issued to storefront applicants, creating an average density of about 1 store per every 19,000 people, which is what we actually recommend in our model ordinance as a fairly good protective ratio. Almost 30% required that the distance between retailers and schools be greater than the 600-foot buffer required by the state. 38% required buffers between retail stores to kind of space them out a bit within their jurisdiction. And almost 70% added other locations that stores had to be distanced from. So these included residentially zoned areas, libraries, parks, churches, substance abuse treatment centers, different places that the communities determined were sensitive use sites for some reason, and they're specific to that community. And then finally, just 17% required that health warnings be either posted in stores or handed out to consumers. And as we've mentioned before, the state currently just requires a small warning on cannabis packaging. In terms of taxes and prices, 75% of jurisdictions imposed a local retail tax. but that's still 25%. They're allowing retail stores and not obtaining any revenue from that. And then further, just 4 places that did impose a local tax dedicated any of that revenue to youth prevention or equity. So that's a big opportunity missed. Just 1 place, as of January 2020, had a tax by THC content, although 1 more has passed one since then, and we'll talk about that. 3 places prohibited the use of coupons or other discounting tactics, and the state prohibits free cannabis, but there's lots of other ways to get people to sort of buy more than they would have otherwise by having, Monday sales, or 2 for 1 and other kinds of things like that. And then so far, no one has adopted a minimum price. As we've mentioned, the increasing potency of cannabis is something that we're worried about and we're trying to keep an eye on. And so far, San Luis Obispo is the only jurisdiction who has addressed this by awarding more points in the licensing process to applicants who committed to selling low potency products. And then in terms of the cannabis kids menu, just 1 jurisdiction has banned flavored products for combustion or inhalation. So that's like the grape flavored blunts. 3 places restricted the sale of Cannapop, so these cannabis infused beverages, and 2 places limited products and packaging with appeal to youth in a way that was either more specific or more comprehensive than the state has done. So we know youth exposure to cannabis marketing both decreases teens' perceptions of the risk of use during adolescence and also increases their interest in using. And just 16% of jurisdictions with retail stores limited billboard advertising in some way. No one has required health warnings on ads, and 3 places restricted making claims regarding the health benefits of cannabis. The most popular marketing restriction was in limiting business signage at just slightly over half of jurisdictions. And 7 places limited marketing with particular appeal to youth, again, in a way that went beyond what the state required. For keeping air smoke-free, 10% only of jurisdictions expressly prohibited retail sales or consumption during temporary events. So these could be county fairs or outdoor concerts, where the sale and use of cannabis might be very public, especially to youth. And then 57% expressly prohibited the consumption of cannabis inside of retail stores. That's the on-site consumption. Though we also gave points this year to places that were silent on on-site consumption, as we figured without express permission, creating a cannabis lounge would be fairly difficult. And then finally, just 5% of places gave any kind of licensing priority to equity applicants. Just 6% made any hiring requirements that advance equity interests, and 6% offered cost deferrals or fee waivers to equity applicants. And then in terms of conflicts of interest, 38% of jurisdictions prohibited having prescribers on the premises at a retail store for the purposes of evaluating potential patients for recommendations. But just 3% said prescribers couldn't own their own retail stores, which is another area of potential conflict of interest. So if you were following the numbers, you'll have seen the most popular provisions among California jurisdictions for storefront sales were having a local retail tax, capping the number of outlets allowed, requiring distance from retailers to other locations specific to their community that may be sensitive use sites, prohibiting cannabis lounges, and then finally restricting business signage. So these are all great key provisions to help protect youth and public health. But as we've been talking about, there are a lot more tools in our toolbox to advance our goals. So next, I want to talk about some places that have passed some really good innovative laws that we hope to see a lot more of. So Contra Costa County protected youth by prohibiting flavored products for combustion or inhalation. So no more watermelon bubblegum joints. And they also banned vaping products more broadly. Cathedral City, and more recently Grass Valley, passed a tax based on THC content. So Cathedral City taxed different types of concentrations at different amounts. And Grass Valley is taxing at a 1% gross receipts per every 1% increase in THC above 17%. So 18%, 19%, 20% each get taxed at 1% more gross receipts. And then they also taxed cannabis infused beverages at 20%. Pasadena, Chula Vista, and Mono County all prohibited or restricted the sales of cannabis infused beverages like this 100 milligram THC iced tea lemonade in an 8-ounce bottle. And Mono County also required improved health warnings in stores that are more specific about, for instance, the kind of risks possible from using during pregnancy and using during adolescence. So thank you all for your time, and feel free to reach out with any questions.
Thank you, Alisa. And now we will be jumping into the Q&A section of the webinar. So first off, we have some retailers have offered school districts financial donations. Is this considered as part of the report card conflict of interest analysis? Sometimes the gifts are direct donations. Sometimes they are offered through a community organization such as Rotary Club. Lynn, you want to start us off?
Sure. Thank you, Kiara. It's a great question. So our scorecards were based on things that we could verify by reading the laws for each jurisdiction. So that placed certain limitations on what we could include in the scorecards. And there are a lot of practices going on at the local level that we couldn't capture for these purposes, although we often got comments back from jurisdictions about things that they were doing. And one of the things that we see quite a bit of is cannabis industries trying to improve their community relations and perception by giving money to good causes, or sometimes not so good causes, but commonly offering money to school districts, to other places. Sometimes that's done as regular businesses donations. Sometimes that's done through actual development agreements that have been brokered by local government, where businesses that apply for local licenses agree to put money towards specific activities, for example, school programs, and we've seen a number of those. In general, I would say that our position is that it is much wiser for jurisdictions to tax these businesses locally and to tax them at a high enough rate, rather than asking a cannabis retailer to pay, for example, for a youth education program. I think there is a huge conflict of interest built into education programs that are funded by the manufacturer or the distributor or retailer of a product that is harming youth. And that it would be much wiser to simply tax the sale of those products, capture the revenue, and use it for prevention, education, and reinvestment in communities. So I do see those as not great public policies to have retailers funding educational programs directly rather than through, for example, public programming. It's a little bit hard in California jurisdictions. Well, you have to take any tax to the voters. So we didn't talk about it today, but we do have 2 model ordinances for California on how to pass a tax at the local level, a dedicated tax and a general tax, and language suggesting how those tax funds can and should be used and how to structure that in a community to capture that revenue. And our new model ordinance, if a community adopts a local nonprofit monopoly model, how you can capture franchise revenue for those same purposes.
Thank you, Lynn. Next, we have, do you have any plans to include other types of regulations in your grading system? My city allows manufacturing and distribution and just permitted a vaping manufacturer. It would be nice to see manufacturing and distribution of high-risk products be included in your scoring. Alisa, do you want to help us with that one?
Sure. Yeah. So when we initially did our model ordinance, and Lynn, jump in if I get any of these details wrong from 4 years ago, we did a legal analysis of what cities and counties could authorize and could regulate. And one of the areas where we wanted to be careful about was having retailers regulated in terms of what can be sold, but it was more difficult to regulate what could be manufactured, in part because those products can then be shipped to other places and other jurisdictions where it might be allowed. So as the consumer facing portion was these retail stores, that's what we focused on. But we do recommend requiring that retail stores not be allowed to sell these kind of higher risk devices and products and things like that. So that's kind of where we landed on that one. Lynn, does that seem right to you?
Yes.
Thank you. Moving on. I am concerned by the use of the term prescriber when medicinal use remains a medical recommendation, similar to the medical recommendations to drink a glass of wine for heart health.
Yeah, so I can grab that one. I think that's a great point. We often have lengthy conversations about what are the right words to use for a lot of these areas, and prescriber is one of those. Cannabis came back into this market as a health product in a lot of ways, and as a medicine, even though there is not at all the same standard being placed on cannabis as there are on regular drugs and devices. But prescriber is often the word that is used in ordinances, which is why we've adopted it as well, as this is the means by which we are trying to speak to jurisdictions and get them to revise and improve their ordinances. So we adopted it for that reason, but I agree it has a health benefit connotation and a true medical recommendation kind of weight to it that we need to be cautious about.
I can chime in a little bit on that one. So if you are doing medical use is supposed to be informed by an actual prescription from a licensed prescriber. It's not an informal drink a glass of wine or get an hour of exercise. And the ethical obligations on physicians who prescribe cannabis under recommendations from the state medical board are that they have to do so the way they would use any other medicine. They're supposed to examine the patient. They're supposed to diagnose the patient. If they prescribe cannabis like any other medicine, they are supposed to follow the effects, adjust the doses appropriately, and so forth. So they have the same ethical responsibilities that they would have for any other product. So why I have many questions about many of the supposed or alleged medical uses of marijuana, which go beyond what's actually proven in the science, although there are some proven, well-documented effective areas as well. Legally, physicians who prescribe are prescribers. And so when we talk in the ordinance about prescribers, we're referring very specifically to the role of a physician who's writing a prescription for medical cannabis, and that they should not have a financial conflict of interest in the cannabis business. For many years, we've had prohibitions on physicians operating their own pharmacies, for example, for the same reason, so that they would not be enriching themselves from their own prescriptions. So we were recommending a similar limitation on conflicts of interest in our ordinance.
Thank you, Lynn. Next, we have what county scored the highest and why? What county scored the least and why? Alisa, Jason, one of you want to take that one?
I can take it. So City of San Luis Obispo scored the highest with 52 points. As to why, the specific categories, they got 6 points for their equity and hiring requirements. So 3 points for their equity requirements. So 3 points for equity priority for business license applicants, and then 3 points for equity and hiring requirements specifically. They prohibited temporary events and on-site consumption. They didn't allow a prescriber to be in ownership of a cannabis business. They got partial points for limiting billboards, 3 points for business signage restrictions. They limited high potency products. They had a local cannabis retail tax. And then they got a lot of points in the retailer requirements additionally. So They limited the number of retailers. They required a distance greater than 600 feet from schools. They required distance between, so buffer zone between retailers. They had other restriction locations. So there was, in addition to like schools, they had other sensitive use sites that dispensaries or cannabis retailers had to be a specific distance away from. And they had required health warnings be posted in stores. And yeah, they got the total score of 52 because of all that. And the lowest score, well, Elisa, you may want to take this. I believe the lowest score was 0 points with Arcata, but I'm not sure if they're the only jurisdiction. They are. Okay. And they didn't get.
Yeah, I think they're the only jurisdictions that got 0 this year.
Yeah, and then they didn't get the points because, again, this scorecard, I just want to be very clear. This is evaluating how a jurisdiction went above and beyond state law. So just because there's 0 points doesn't mean they have no provisions in place. I mean, maybe no provisions in place to support social equity in the cannabis industry, but because the state doesn't, but the state does have provisions in place, in some areas, very robust provisions. So we're just identifying some of the gaps, some of the inadequacies, and help providing a tool to show you the ways in which you can fill those gaps.
And specifically, Arcata added additional sensitive use sites that required distance between them and retailers. They also had distance between retail outlets themselves, but then they decreased the 600-foot buffer between retailers and schools, which is I think the only provision we had where you could actually lose points. So they got 5 points for the other provisions, but then they lost 5 points for the retail buffer distance from schools. So specifically, that was that issue.
Thank you. Many cities with ordinance have amended them to weak or stronger. Did the scorecard scores go back and review the most current version?
Yeah, so the scorecards, they evaluate the policies that were passed. So the 2020 scorecards evaluate how cannabis was regulated going into the year 2020. So it reviewed the policies passed between January 1st, 2019 till December 31st, 2019. So
well, actually going back even farther. So if they had like a legacy ordinance in place restricting something, we went back in time to about 2017, well, even farther in some cases, but most places put into place provisions specific to adult use in 2018. And so, sorry, go ahead, Jason.
Yeah, and so if they updated it, I guess what I'm saying is if they updated those policies between January 1st, 2019 and December 31st, 2019, then that updated version would have been included. If they didn't update it, then we would have gone with whenever they passed the ordinance, whatever that ordinance was.
And the bottom of the scorecards shows what their score was the year before and if they made progress or went backwards, just precisely to measure what you were asking about, Serena. Did they get weaker or did they get stronger? And we have some numbers looking at that as well. And we are planning on doing at least two more years of these analyses. So the idea is to really check on what's happening in our cities and counties across the state and if they're protecting people better, and to create a public and advocacy pressure for improvement. So these scorecards work best, and the American Lung Association ones work well because they have a network of people across the United States who are advocates, often against smoking, for example. So we really hope that all of you who are partners in our community, who may be substance abuse activists or tobacco control activists or nurses or doctors or school people who work in schools, that you take these scorecards and you use them as a tool in your community to press for change and to say, why aren't we doing these things to protect our kids? Because that's the way these scorecards will be most effective. So this is the first time we've done them publicly, but we really hope that all of you can be part of our team in coming years to make these scorecards more effective. Unfortunately, this one came out right the week of the Capitol riot, which caused a lot of distraction. But we hope to really work with more and more partners each year to help advocate for change. That's why we're doing.
Thank you, Lynn. And then piggyback off that, are there any state bills being considered or discussions at the state level to specifically address some of the public health recommendations you have made?
I guess I would take that one, not enough. In general, the state legislature has been very broadly pressured by the cannabis industry. And if anything, there are more bills to make protections weaker. rather than stronger. There was one bill, for example, though, to go back to the original billboard protective language in Prop 64, but that became unnecessary because a lawsuit on the issue was successful. And the state is going back to not allowing billboards on most California highways, which was what was specified in Prop 64. So by the way, guys, if you see billboards up on highways in your community, file a complaint and ask for them to be taken down, because you can do that now. But we need, California passed a ban on flavored tobacco in 2020. We need to do the same thing for flavored cannabis and make our laws consistent, because we know these are starter products for young people. We need better warning labels on products. We need stronger equity requirements um, and restrictions on high potency. We are working and we're successful to get a recommendation out of the State Advisory Committee for a task force to look at the issues of high potency, something that Washington and Colorado have done and come up with best practice recommendations. But that has not actually been raised by the state legislature yet, although it is being discussed in other states and Quebec, as I mentioned. So no, we have a dearth of hard policy proposals to protect youth. And in fact, at the state level, our regulatory agencies are being consolidated into a single agency, and we run the risk of things perhaps getting worse, if anything, with the part of regulation that was under our Department of Public Health leaving the department.
Thank you, Lynn. And then we are almost out of time. We have maybe room for one quick question. Our dispensaries seem to use a loophole and no prescriber on premise. They direct people to an online site where they get a recommendation, and the cost is then used towards purchases of product. Um, any recommendations on that?
Yeah, we've seen some ordinances say you cannot have a prescriber available either on site or available by like digital communication somehow. That just adding that language, I think. I mean, I imagine it's a hard thing to enforce or police, but that is how some jurisdictions have dealt with that issue. And I think you can write in prohibitions on discounting, and that would be one that could fall into no use of the cost of getting recommendation card to your purchase. So I have not seen that.
Thank you. So then we are almost out of time. You can go ahead and feel free to email or contact us. We do have our website, www.gettingitrightfromthestart.org. You can contact us that way. You can also join our listserv through our website, and you will find a copy of the new 2021 model ordinance there as well. And thank you for joining us today. The recording will be available within a week. So if you want to come back to it, you can. And we will also be providing the slideshows.
And we'll try to answer questions that went unanswered as well.
Yes. All right. Thank you all for giving us your time.